Thank you, and welcome to Bennington's Community Policing Advisory Review Board meeting. Today is Thursday, June 15th, and it is 6 p.m., and we are in the third floor multi-purpose room at the Bennington Firehouse. My name is Kelly Carroll, and I have the pleasure of chairing this board, and I am going to ask my fellow board member to introduce himself.
I'm Marsh Hudson-Knapp.
Remotely, we have Jeff Vickers. We also have our select board liaison, Tom Haley, and CAT TV, Jim Byers. So thank you so much to CAT TV. And unfortunately, we do not have a quorum, so we will not be having our official meeting this evening. We had planned on our agenda to have a board reorganization and election of officers. That will obviously get pushed back to July. Public comment, we will not be having public comment. We did not have anybody sign up for public comment this evening, or we would have that. So we don't have our outreach committee present really as far as like in updates, but we do have Lorna Matern here from United Counseling Service, and she will speak about their relationship with BPD. And we also have Chief Doucette with us, and he will speak on the new laws and the changes to those existing laws that are affecting policing. We do have a couple of updates about our upcoming community listening session, and we will table the 2023 town survey until next month, and then just talk about announcements, and most of our items that we had this month will be postponed to next month's agenda. And I do apologize. We have some members who are just not able to attend, and we have a couple that are trying to attend remotely but are not able to connect. So between Jeff, Marsh, and I, we don't have enough. So thank you very much. And to start us off this evening, I'm just going to ask Lorna Matern, who is the Executive Director of United Counseling Service, to just come up and talk about UCS's relationship with BPD. And I want to thank you, Lorna, for being here. And I also want to thank you and your team for all of the work that you've been doing locally with not only community members, but members of BPD. You know, we've had a lot of trauma, so thank you.
You're welcome. Thanks for having me today. I'll talk a little bit about United Counseling Service just briefly, just so folks know kind of our reach within the community. We work with about 3,000 members of your community across Bennington County, and we employ about 320 employees, and we oversee about 15 facilities between Bennington and up to Manchester. We provide services through the lifespan, so early childhood with Head Start and Early Head Start, and through death with elders and also people in our group homes. Provide services like outpatient mental health, substance use. We have a medication-assisted treatment program, children and youth and family services, services to people with chronic and persistent mental illness, people with developmental disabilities, group homes, crisis stabilization, and crisis and emergency services. Many and all of those, we could actually interact with the Bennington Police Department, whether it be a staff issue sometimes, or most of the time it's not, or it's a potentially a client issue where we might need some help and support from the police. We respond to mobile crisis, and oftentimes we have to call the police to come with us, depending on the circumstance. So our interaction and collaboration with the Bennington Police Department is vast. The relationship that we have is really incredibly positive. We both support each other. So when we have a crisis and we're concerned for safety, we call the Bennington Police Department. When the Bennington Police Department has a mental health crisis that they're dealing with, they call us. We work to support them through, you mentioned, Kelly, the traumatic events that have occurred in our community, certainly over the last year. At one point, there was a multiple very difficult and very public and traumatic suicides in our community that the Bennington Police Department responded to, and that affects police officers. I don't know how it couldn't, right? So we really made ourselves available to them. From our psychiatrist, Dr. Alia Reeve, who went to the police department and had a hour-long session with 4 of the officers to do a debriefing, to our mental health clinician that's embedded actually with the state police that stopped by the Bennington Police Department one evening to check in on the dispatcher who got the call to make sure that she was okay. We just look out for each other, and we have to. It's difficult out there these days, and without the relationship that we have with them, I don't think that we could do our job. And so I think it's just really important for you to know and the community to know how positive it is in the relationship. And I'm not just saying that because Paul's back there. The relationship is really quite good, and we rely on each other.
Thank you. I want to thank you for that and for clarifying that. I think it's important for the community to hear about that collaboration and, how the agencies and departments are working together. So, as you know, and this is a topic that we'll get into later this evening, we have our listening session coming up. Yes. So, is there anything that you think that we can do? I mean, you talk with your clients, and we want to help build trust and open communication. And when we do get into the listening session, it is about, what community policing is to them. Is there anything that you think that CPARB can do to help the community build trust and transparency from things that you've seen or heard from maybe some of your clients?
Well, it's interesting because I'm a little bit more removed, right, from the day-to-day on the street kind of as the executive director. But I could tell you that I've not heard negative feedback from staff or from clients or through staff around clients having a negative interaction with the police department. I think there's greater mental health concerns with people that the police department is interacting with, and they are not mental health clinicians, they're police officers. And I think one of the things that I think is really important is for the community to know that we are collaborating together, and that part of what that collaboration is that I think they're also learning how to interact in a different way when it's a mental health crisis versus a criminal situation. And that's something that they've learned over the course of my time in working with them in the community. But I think really just to make sure that people understand that there is a collaboration and a partnership, and we're relying on each other. And I know that they are committed to interacting with their community in as positive a way as they possibly can to respond appropriately when it's really a mental health crisis versus a criminal situation. And I can tell you too that the Bennington Police Department, the members of the department love their community. One of the things that really struck one of the workers that was having a debriefing after a suicide was it wasn't that they weren't talking about this terrible community, they weren't talking about how hard it was, they were talking about how much they want to give to their community and how important it is, and how they want it to be a positive, good, safe community, and they're committed to that. So I think really just making sure that people know their officers and know what they believe in and what they stand for. I'm sure there's problems everywhere. There's problems at UCS. There's problems everywhere. And I think as long as we can be transparent about what those problems are, then it becomes more of a trusting relationship.
Thank you. Marsh, did you have any
Well, I was just
questions?
struck by your, oops, am I supposed to? Is this on or off? No. Okay, good. I was struck by just your comment about knowing Bennington police officers. We got to do ride-alongs when we started in this role, and we got to know several of the officers, many of the officers, through our interaction there, and they really are amazing people. And a lot of people don't know the officers well personally, and that's something we've never talked about, but I think it's a good thought are there ways that we can help people? I mean, there are certainly public events where officers are present, but it might be great to have a get to know your police officers event.
Yeah.
And I'm really glad to hear about the collaboration that happens. Are there things in the last year or two that are different in the interactions you have with the police department?
Different. I think some of the additions to our relationship over the last couple of years is really much more of a collaborative relationship as far as mental health is concerned. I think several years ago, I think the police department was more in line of, they're policing. They're police officers. They're not mental health workers. We need to be doing our police work. And that having an embedded mental health clinician was not, I don't think, anything that the state police, the sheriff's department, the Bennington Police Department would be something that would have been of interest to them because of we do police work. We don't do mental health work, right? And I think over the last year, it's very clear how much they've embraced the idea of being able to have an embedded mental health worker and how important it is and how beneficial it is. Really open to training and consultation around how to work differently in approaching somebody with a mental health issue. It's a very open department.
That's great. Now, you said that's great. And you said that they're more open to an embedded mental health worker. Now, that's happening in the state police, right?
Yes.
And it's not yet happening in Bennington. Is that right, or is that wrong?
Not yet, but working on it. So there's some short-term, about 2-year funding, and that I know that the chief and Lieutenant Grandy have had some conversations with public safety at the state level around finding some funding to be able to embed a second person in the Shasbury Police Department that would be partnered with the Bennington Police Department.
Oh, cool.
So they would be a liaison that would be embedded with Bennington Police Department. So the hope is that that will be happening sooner rather than later.
Great.
I just want to add a comment. When we went to the summit, one thing that came out, and I don't remember, because I don't know a lot of the officers, and they were probably more at the state level, but they really put it into perspective for me, for somebody just learning, that, with the way everything is changing in society and out on the streets, we have, without that, say you don't have that collaboration. If we don't have that collaboration, we have police officers who are out trying to address a mental health issue through policing, and then we have other like criminal, not really criminal, but law issues that social services has to take and tries to treat from a social aspect.
Right.
So I think, having that collaboration and education, for me, it's all about education, because if we don't talk about it and we don't train people, you don't know what you don't know.
That's right.
So I think this is great.
And I think it's a delicate balance between approaching and intervening with a mental health issue and a criminal issue, and how you work together to figure that out. I mean, our emergency services clinicians will talk with the Bennington Police Department and say, okay, here's this person who's threatening to hurt somebody else. How are we going to approach the house? Is it the police officer that's going to approach the house? Is it safe? Is it the mental health worker that's better because they'll be triggered by the police officer? And it's really that delicate balance in figuring out how we support each other through those circumstances. And it really has, I think, by having that kind of relationship and that planning before going into a situation has resulted in really positive results.
I think it's been helpful because I've talked with people up in the Shasbury office, And they'll say, they've told me that there's times that they'll go in together, and if it is a mental health issue, he'll step forward. If it's, something more where they're getting a little out of control and they need, the officer to try to work with them, then they'll take a step back and sometimes deal with the family members in the community.
That's right.
And I think that that's very, very just important, because it's what you see and what you witness, and sometimes there is a lot of trauma, and there's people that see that as well. So
Yeah,
I think that collaboration is important, and I really hope it does come down, even if it's through VSP to Bennington. But I do hope that we get a certain guaranteed percentage of allocation to Bennington, so that that person doesn't get pulled out to VSP.
Excuse me, I agree. I hope that happens too. And the reality is that the police department doesn't just work 8-hour shifts a day, right? So right now,
24/7.
Right, and right now, the funding that we're hoping for is one full-time mental health clinician. So really, it's then what happens the rest of the time that we have to continue to grow that program.
But it's a start.
It is a start.
It's a start. So, thank you. Jeff, did you have any questions?
No, I'm good, thank you.
Okay.
So I have another one or two.
Oh, I'm sorry, I cut
No,
you
that's
off.
not all
My
right. I was
apologies.
you don't need to apologize. So I'm wondering, how does the connection work? Like, do the police department call the office and then whoever on the, how does this transaction happen?
Oh, texting each other, calling each other's cell phones directly. I don't think the Bennington Police call the front office at all. They just call the person directly. I'm looking at Paul for confirmation.
It's a combination.
Yeah. So, it's just, we share each other's numbers, we get in touch with each other, they'll call the front office who can't find anybody. So it's just really a direct personal relationship, most of the time.
Mainly between officers and mental health workers, or are supervisors and you involved in it at times, or is it just?
I'm not involved in any of the crises in the moment. I'm
Yep.
mostly involved in the afterwards. So if there's, Paul might text me or give me a call, or Cam, if there's something that comes up that they need somebody from UCS to help debrief, or they'll call directly to the director or the emergency clinician if they need something. So, it just kind of naturally happens through the relationship.
That's great.
Yeah,
Really exciting and important, so.
I agree.
Any other questions?
Not that I know of.
Okay. Anyone else?
Tom, did you have any?
Okay. Sam, I just need you to come up and state your name and town and ask your question, and
I can
then...
give an actual account, and it's going to, Sam Rustino from Bennington, Vermont. And this goes back 2013, and you talk about mental health, you talk about Alzheimer's with my dad. Back then, the burden was on United Counseling because they didn't have the counselors on this new mental health issue of Alzheimer's, and same way with Bennington Police Department. When I had a situation dealing with my father, every officer that came to my dooryard, I had to explain of the incident. And I tried to educate Bennington Police Department when the call came through, it would give a brief history of certain instances that happened that the residents, my father has Alzheimer's, so this, when the acting officer did arrive, they would have a brief idea of what the incident is about. Sometimes the officers knew about it, sometimes they didn't, but I think I possibly met the entire Bennington Police Department because of my father, my dad acting up from Alzheimer's. That has increased considerably because of the more personification and education of Alzheimer's through Bennington Project Independence, BPI. I am a self-proclaimed caregiver. They help out with the caregivers. They give suggestions on how to respond to certain instances with Alzheimer's patients, especially aging parents or aging in place. Neighborhoods respond because they know of the situation. I mean, obviously, you get a little noisy, the neighborhood calls in, Bennington Police respond. At the time, counselors weren't available at United Counseling Service. They had an Alzheimer hotline. The boys in blue showed up. I was taken in police custody to be at Southwestern Vermont Medical Center to be evaluated because I was under a stressful situation. And I had to wait for a counselor to show up so I could talk to them. And when they heard about Alzheimer's, then they went, oh, then the light came on. I strongly urge the public to get trained in mental health first aid. Yes, there is such a thing, and she knows about it too. The word AGLEE, A-G-L-E-E, ask, listen, give, and I forgot the other 2 E's. But I am certified as a mental health first aid, so if somebody does act up a little bit, I know how to ask a certain question. Not totally, but I have a little more knowledge on the general public.
Okay, well, thank
And
you.
yes, you're right,
Thank you, Sam.
communication is key. So it's a matter of collaboration with Bennington Police Department, the Bennington Rescue Squad, the hospital, and BPI, and they have come a long way. So,
Thank you, Sam.
And if you don't mind, I'm going to jump on a little bit what Sam said around mental health first aid. UCS does train mental health first aid, so if anybody's interested, they could just connect with UCS or get on our website because they'll have dates for mental health first aid. And essentially what that means is, like first aid and CPR, it teaches you how to respond to somebody who's in a medical crisis, but you're not going to treat them. Just the same with mental health first aid. It teaches you and helps you understand and recognize if somebody's in distress, and it teaches you how to respond, but you're not going to provide therapy. So it's a course that we can teach to anybody in the community that would like to learn about it.
So is that something that's offered with some regularity, or?
We usually have something that's scheduled once a month, once every other month. They're posted on our website. I know we had one in June. I know we had one in September. I'm not sure within the summer period of time, but certainly you can get on there and you can sign up online.
How long is that class?
Yeah.
I think it's a total of 5 hours. There's some pre-work that folks do on their own online, and then come in and do a class together with the rest of folks, which could be up to about 20, 25 people.
And that's open to the public?
Yes.
Okay. Thank you. Thank you, Sam, for mentioning that.
yeah, well, I'm glad I showed up tonight.
Well, me too, so thank you. All right, any other questions or comments for Lorna?
Thanks for inviting me.
Thank you, and again, I apologize about us not having a quorum, but I'm very, very grateful that you were able to come and tell us about what's going on, and maybe we can get you back in the fall.
Anytime, just let me know.
Okay,
Well,
thank you, and thank you for all you do.
Thanks, Kelly.
Yeah, meanwhile, it'll be available on CAT TV, what Laura had to share, so that's great too.
Yes, yep, yep. Next up, we have Chief Paul Doucette, who is going to talk to us about some of the new laws and the changes to existing laws that are affecting policing, and this has pretty much just come out of the Vermont legislature. So,
Good evening.
thank you.
So as you know, my name is Paul Doucette. I'm the Chief of Police and Public Safety Director here with the town of Bennington, and I attend these meetings on a regular basis. I was excited to learn that Lorna was going to be here this evening, and I'm going to start, before I touch on these laws, by just adding a little bit to what Lorna brought up, just so there's no questions. Lieutenant Grandy and I have been working and collaborating with the Department of Public Safety in an effort to bring a second clinician to the Shasbury Barracks, which would then be assigned to the Bennington Police Department. It is state funding, and right now we're just trying to figure out how best to use that funding. Again, it is money out of the Department of Public Safety. They want a commitment from the town of Bennington to make an effort to come up with our own funding after this money runs out, so that we can keep the program going, which I think is absolutely essential. Lorna touched on it. We are a 24/7 agency, the Bennington Police Department. We can't have a clinician, 24 hours a day. That's just just not affordable. But we can, and Lorna and her staff and Cam and I have talked, we can have a clinician assigned to the Bennington Police Department, working in the Bennington Police Department, and stagger those hours so that we can have coverage at certain times during the day. And so we are excited about that. Clearly, it's not a Monday through Friday job, just like this job is not Monday through Friday. So those are things that we have to work out. Bill Elwell, assigned to the Shasbury Barracks right now, is amazing. He does check in with me. He checks in with Lieutenant Grandy, and as Lorna said, her staff has been in our office several times. It's been a rough first 6 months, 5.5 months of the year, and again, had another shooting over the weekend, and with a victim, and it's challenging. It's not as easy as it used to be. It's not all about just going out and stopping cars and riding bicycles downtown. There's a lot of work to be done, a lot of criminal work, and with that, there's a lot of mental health issues. So my role here as the police chief is to work with United Counseling Service, and I agree with everything that Lorna said. I think that we have an excellent working relationship. The piece about the last, Marsh, you asked, the piece about the last couple of years, attitudes in law enforcement towards people with mental health issues has definitely changed. We don't force people into a car. We don't force people into an ambulance. We don't drag people into the hospital. We've all had mental health first aid training. We've had other types of training. Sam touched on the Alzheimer patients, dementia patients. We have been through the program at BPI where we go into the room and experience what it's like to have dementia. There's a lot of positive things that we, the Bennington Police Department, are doing to make sure that we're able to understand the needs and desires of people within our community, especially people with mental health counseling. And we have Lorna to thank for that, and the staff at UCS, BPI, the hospital, obviously, is the staff at the hospital, especially the emergency department. Is huge. We're all watching that hospital expand. They're going to finish this project, hopefully, and then they're going to start on another project up there. The hospital continues to grow to meet the needs. UCS continues to grow to meet the needs. The Bennington Police Department staffing continues to shrink, and we're not meeting the needs. So with that being said, there are several laws that have recently passed in legislation that I just want to speak to you about, because some of them Lieutenant Grandy and I and my staff have been instrumental in, and I think it's important that you know that. Working with some of our local senators and representatives. So while we're on the topic of mental health, I just want to touch base on that really quickly. We have a situation that we're dealing with now where we're trying to get the police less involved in mental health issues unless there's threat of danger. The new use of force policy that was put out by the state of Vermont has been very confusing to sheriffs and police chiefs around the state. And some agencies are out and out refusing to go to mental health calls. We just had a law enforcement executive summit in Killington. The commissioner, Jennifer Morrison, spoke to the chiefs and sheriffs that were present. And the word is to continue to respond to these types of complaints, because EMS providers, emergency medical service providers, are not comfortable just responding on their own. We are still responding here in Bennington. We have not changed the way we do business, and I agree with Commissioner Morrison that law enforcement needs to be involved, but there are some changes. S47 brings about some of those changes. If you think about this, there are under S47, it's been amended. 7505 talks about a warrant and certificate for emergency examination. We can take people into custody, and we must immediately apply for a warrant, a law enforcement officer or a mental health worker. And it has to be a certified physician that actually grants that to us, or a judge. So, it's a lot of work for law enforcement. You're basically writing a warrant. There's not any, you can no longer show up and say, well, Marsh and Kelly are witnesses. Law enforcement has to observe the behavior and then supplement that with what witnesses have to say. It's not just someone's word anymore. It's a law enforcement officer must observe. One of the biggest things that has come out of this that's a little concerning to chiefs and sheriffs around the state, including myself, is at what point do you apply for that warrant? And we have asked Erica Marthage as an attorney to prepare training for law enforcement in Bennington County. I've asked her myself personally so that we have a clear understanding of S47 so that we don't find ourselves in a predicament where we are taking someone into custody and violating the new law. The other piece that goes along with this is the chiefs today. In fact, there is an email chain out. S47 requires that all police vehicles in Vermont carry soft restraints and not just mechanical restraints. So that people at home and all of you understand, mechanical restraints are regular, we'll call them handcuffs. If I call them wrist restraints, people don't know what they are, right? So regular handcuffs, regular leg irons, shackles, we are now required as of July 1st, 2023, to equip all cars with soft restraints and to use soft restraints when possible. And there's no real clarity in the law. It's going to be really an officer's discretion. If we respond to a location and someone is completely out of control and hurting people, we're not going to struggle to get out soft restraints and try to push the little strap through and attach with Velcro. They're going to go in mechanical restraints temporarily until we can put them in soft restraints. That has to be how it is. It's about life safety, and we will use the soft restraints. But along with that, there's a very short time period between now and July 1st. We have to get those soft restraints. We have to train our people with soft restraints. We have to make those restraints available, because the last thing we want to do is put someone in soft restraints and have them pick at the Velcro and get out of the soft restraints and then hurt someone. Right? So our legislators went ahead and did this without, in my opinion, a lot of information. The hospital is fantastic about when we get up to the hospital, if we have someone in mechanical restraints, the staff will ask that the person that's in restraints come out of the restraints, and they have soft restraints available there. We don't leave people in mechanical restraints or soft restraints unless there's a life safety issue. So that is a huge piece of S47 is mental health, making sure that we're treating people properly, which I believe that the Bennington Police Department does. I believe that UCS does. I believe that the hospital does. And I think it's important that people understand that when the police arrive, there's so many people that want you to just immediately take action. Get that person out of here. And it can't happen like that. There has to be de-escalation techniques. There has to be mental health first aid used. There are steps that we have to take. People will get angry with us and say, why didn't you just remove that person? They were causing such a scene. Well, it doesn't work like that, right? We have to try to reason with people. We have to de-escalate people, and we have to do what's appropriate. People that are suffering from a mental health issue can be traumatized by being placed in mechanical restraints or being put down on the ground by a law enforcement officer. We're trying to avoid that. Are there times that it's going to happen? Yes. But when the police show up and you see us trying to work with people, it's because that's the proper way to do it now. And I think it's important that people understand that. Any questions about S47 before I move on? Yes, Marsh.
What's a soft restraint like? I have no idea what you're talking about.
So a soft restraint is basically, there's a couple of different variants. I was looking at them today. In fact, there are soft restraints out there that are made with leather and are soft on the inside. They're just for wrists. They're $229 just for one set. We have to put sets in every one of our cars. But then there's also soft restraints that are made with a softer material and Velcro, and those are far less expensive. And another technique that Lieutenant Randy and I were researching today is a soft belt made out of a material with Velcro that can go around the waist, and it can restrain people's hands by their sides instead of behind their back. So those are the restraints that we're currently looking at. We're working with our partners down at Porta Brace to make sure that we have proper bags to keep them in. We all know that Velcro, it tracks everything, and we want to make sure that they're clean and that they're pliable and usable, because we all know that Velcro, if it gets dirty, it doesn't work all that well, right? And it used to be that we just had to have soft restraints available. So we had a pair of soft restraints at the office. Rarely use them because they're really of no use to us sitting in the office when we're out in the field, right? So really that's what's going on there. I don't believe this is going to be a huge cost issue, but once again, it's an unfunded mandate by our legislators, and the municipalities and the state police and the county sheriffs all have to deal with it. And we're going to do it. We're going to do it, and I think it's necessary. So.
Well, I just want to say that personally, I find that a little bit concerning that it's a gray area. It sounded like the law said soft restraints when possible, but didn't clarify when possible was, or does it maybe?
Yeah, I think at times, Kelly, that you have to leave that, there has to be some discretion there. I certainly don't want an officer to try to use soft restraints to restrain someone when sometimes the regular mechanical restraints are much quicker and safer if someone's out of control. And I think, that's another reason why, hence, responding with the Bennington Rescue Squad to situations like this, and having the Bennington Rescue Squad and the Bennington Police work together, or having that embedded social worker or a clinician from UCS respond with us, and being able to de-escalate someone, talk them into getting into the ambulance, talk them into going into the hospital, and perhaps using no restraints is an option also. But again, we have to be careful that the person doesn't hurt themselves or someone else. So we have to be prepared all the way around, whether it's no restraints, mechanical restraints, or soft restraints.
I guess I just worry about officer discretion, consistency, and I don't want to say equity, but you could take the two of us in, and Marsh could get the soft restraints, and I could get the mechanical ones, and it could be officer discretion. And then I just want to make sure that there's consistency, protection, not only for the person with the restraints, but the officer as well.
No, and I agree, and it's twofold for me as a police chief, and all of my colleagues around the state are in the same position. I need to make sure that I'm not having an officer transport someone in soft restraints, and they're going to pick at the Velcro and get out of them, and possibly break a window, open a door, and jump out of the car. There's a lot of different variants here, and I think that we have to. No, I don't think we're going to follow the law, and we just.
Absolutely.
Officer safety and the safety of the people in our community are paramount, and we're going to have to see how this goes. There's a lot of discretion in law enforcement. There's discretion in writing a speeding ticket or not. There is discretion in issuing a citation or bringing someone back to the office if they meet the Rule 3 criteria. And I'd like to say that I believe that my officers make really good decisions, and I think that they'll continue to do that with this new law. Okay?
Sam, yeah, go ahead.
Yeah, I can speak on this. I'm gonna.
This is comment in the, brief, and then if it's going to be lengthy, I'm going to ask you to let the chief finish and then come up afterwards.
Oh,
so,
okay.
Okay?
All right, well, I just wanted to.
If it's a brief comment, that's fine, but I'm just going to ask you to have respect.
This is real brief.
Okay.
Before this law came into effect, I'll admit, I've been handcuffed and processed because of the situation that I had with my mom. She's hard of hearing. I was acting up, and the officer felt that I should be handcuffed. I did restrain a little bit, but I was handcuffed and put in the back seat of a patrol car and processed and fingerprinted. This was before this law came into effect. So this is where you use discretions of officers, because the officer felt that I was acting up and they felt threatened a little bit. They had recourse to use restraints.
Okay. Thank you, Sam.
Just so that we don't misunderstand, what S47 deals with people that are having mental health issues, and we'll continue to use mechanical restraints for people that are, arrested for DUI or disorderly conduct or domestic assault or whatever the situation may be.
Okay.
I just don't want there to be any confusion.
Good.
Thank you for clarifying that.
So S36 we're extremely proud of. S36 is an act relating to crimes against healthcare workers and emergency medical treatment providers. A name from the past, Governor Shumlin, Peter Shumlin, back in 2011 actually made it so that it was a crime to assault a healthcare worker, and no different than it is to assault a fireman or a policeman, right, or police officer or a person in the fire department. So he did move that forward because we were seeing a number of workplace assaults and violence in hospitals. So keep in mind that was 2011. So here we are 12 years later, and we're still dealing with assaults against healthcare workers, nurses in the emergency room here, for example, at Southwest Vermont Medical Center, getting punched, getting knocked out, having glasses broken, smashed off their faces. It's a time where action needed to be taken. And I'm proud of the fact that we were able to work with Southwest Vermont Health Center, the emergency staff there, work with Senator Sears, and provide information to Senator Sears so that we could get this passed. So the brief synopsis of this is this S36, which has passed and was signed into law by the governor here in Vermont, does allow the police to remove someone from the hospital and not just simply issue them a citation. In the past, we've had to issue a citation to someone that assaulted a healthcare worker, and when they're medically cleared, they're allowed to leave the hospital and just come to court 5 or 6 weeks down the road. It's not okay. It's not okay to assault anyone, but it's definitely not okay to assault someone that's trying to help you. We've seen it time and time again here in Bennington. You go to the hospital now, whether it's at Albany Med or it's in Rutland, all the hospitals have signs up that say violence will not be tolerated. And this law helps law enforcement make sure that that's correct. Now, to be clear, for the people that are at home and for everyone that's going to watch this down the road, we cannot simply remove a patient from the hospital that is not medically cleared. That's important to know. That was made very clear. Basically what this does, in a nutshell, and I guess I should have told you I'm not an attorney right from the get-go, but the bottom line is we did have a lot to do with this, in my opinion, here in Bennington, and some of the nurses went up north and testified, and we made this bill a reality, and the governor felt the same way and signed it. Basically, what this does is it adds a section to Rule 3 and says that if a healthcare worker is assaulted, not in the presence of a law enforcement officer, if the person is medically cleared, they can be removed from the hospital, processed, and given the proper paperwork or remanded. So that's a big change to Rule 3 for an unwitnessed crime, for the officer to be able to take someone into custody. But again, I want to make sure you understand that we can't take somebody into custody if they're not cleared medically by the physician.
Does that apply to physicians' offices, the primary care sites, places like UCS as well, or is it just the physical hospitals?
It talks about, there's definitions. It talks about emergency medical personnel. It talks about healthcare services. It talks about healthcare worker.
Okay.
So, again, I think when we have our legislative update with Erica Marthage from the Bennington County State's Attorney's Office, that will be addressed.
They'll clarify.
Our primary concern right now is to make sure that we're protecting the staff at the hospital. But I understand what you're saying. We are rarely called to a doctor's office or a medical office building unless we're assisting the Bennington Rescue Squad. Our calls primarily are to the emergency department here at Southwest Vermont Medical Center. I think that, Tom D., the CEO of the hospital, was instrumental in this, allowing his staff to go up and testify. And, the piece that I just want to make sure that you all understand, when a law enforcement officer does respond to an alleged crime by a patient at a hospital, okay, the representative at the hospital has to disclose to the law enforcement officer information about the officer removing the patient from the hospital. If the information is sufficient to confirm whether the patient is stabilized, has been evaluated, or is awaiting some type of inpatient care. So, if someone's going to be admitted to the hospital, we've all seen it. People that have a ski injury, for example. Let's say somebody has a ski injury and they have some type of head injury and they're not acting appropriately, and that behavior is a result of the injury. Well, clearly, they may be awaiting inpatient care, they may be staying at the hospital, and us taking custody of that person and bringing them to a correctional facility is not the answer. And the law addresses that very clearly, and even states that the officer shall not remove the patient from the hospital if an authorized representative from the hospital informs the officer that the patient is not stabilized or has yet to be evaluated. So if you present yourself in the emergency department and you've yet to be evaluated, we can't just simply go there and remove people. We might stand by, we might wait for the evaluation depending on the person's behavior. The hospital has a security team in place now, and at least here in Bennington, and many hospitals now are retaining law enforcement officials, deputy sheriffs, so on and so forth, as a result of some of the violence that's occurring at medical facilities. So I think it's important that people understand that this isn't go and take someone from the hospital that needs medical attention. It allows us to act in the event someone, we see it. We see people that are evaluated, they're released, and they refuse to leave the hospital because they want to stay for whatever reason. So we've seen people break windows, we've seen people smash furniture, and we've seen the biggest fear is, the nurses being assaulted. So the law goes on, and I'm not going to get into all the details, but the law goes on about reports, being sent in, and the Department of Public Safety has to make reports to the House and Senate committees and the judiciary. Again, some of these are rather lengthy. I'm not an attorney, but we are pleased that we had input into this, and we are pleased that we're going to be able to help the people in the medical facility here in Bennington that save people's lives every day, and they should not be prone to abuse. So we're happy about that. One of the biggest bills that I think this year that went through the Bennington Police Department was instrumental in this because of what we're seeing in Bennington and around the state of Vermont with violence. Bennington, Springfield, Burlington, South Burlington, Rutland, and the list goes on. And what we're seeing, we shared our information with Senator Sears. Lieutenant Grandy, while I was out on medical leave, was able to testify about the cases that we're involved with here in Bennington. 22 shootings last year in Bennington. That's a lot. 2 homicides in Bennington. That's too many. And we were able to share some of the things that we're seeing. So S4 went back and forth between the Senate and the House several times, and now we're looking at human trafficking, straw purchases of firearms, carrying firearms during the sale of narcotics, carrying firearms during the commission of other crimes. We mirrored some of the federal law on straw purchasing of firearms and defacing firearms. We have seen a lot of ghost guns. Now, ghost guns have two different meanings. You can have a ghost gun that's been built with parts, or you can have a ghost gun, we call it a ghost gun because the serial number has been defaced. And we always had to rely on our federal partners to bring that charge, and now with the new law, it will be a violation of state law. And so S4 is very lengthy. It talks about juveniles. We all know that some of the activity that we've seen out of Springfield and Holyoke involves 16, 17, 18, 19-year-old kids, people down there sending the younger generation up here, carrying guns and slinging dope. So, and this addresses that. And this is not, hey, vote for Senator Sears, vote for Senator Campion. This is, some of these people worked extremely hard to make sure that this legislation went through. And again, on this, Governor Scott did believe that this needed to happen. There's parts of this law that talk about permitting sale of regulated drugs in a building, landlords or building owners not taking action to prevent this type of activity. And I think it's important that people actually take the time to read this legislation. It talks about fugitives from justice. There's just, in trafficking regulated drugs. It goes on and on and on. And I think it's important that people understand that our legislators got this right. And again, we have to rely on our state's attorney's office here locally to make sure that we are following this new law. This also adds, and I'm very excited about this, it actually adds a community violence prevention program. Without getting into all of the details on that, because I'm not the Commissioner of Public Safety for the state, I think it's important that people take a look at this and they understand that there's going to be funding available for communities that are struggling, communities such as the communities that I have already mentioned. And so I think that's important.
Can I just interrupt for a question?
Sure.
So Commissioner Morrison is the one that has the community violence prevention program?
There's a whole list of people that are responsible.
Okay. Is that on like their website, the public safety?
So right now, I think that they're going to be putting that together, but there's so many people that are going to be involved in this that have had things added to their plates to make sure that we're able to, for example, making sure that juveniles get the help that they need, making sure that that there's prevention where it's needed, and making sure that there's there are programs. And I mean, it goes on. I'll just read it to you very briefly. Establish the Community Violence Prevention Program to be administered by the Department of Health in consultation and collaboration with the Chief Prevention Officer, Department of Public Safety, which would be Commissioner Morrison, the Director of Violence Prevention, the Executive Director of Racial Equity, and the Council on Equitable Youth Justice. And they're tasked with making sure that communities implement evidence-based and evidence-informed programs addressing the causes of youth violence. And so it's a lot of work. Like it's not just about, okay, we created some more laws so we can arrest people. We created laws to keep the community safe, and we've created within this bill, we've made it so that we can look at what's causing these issues and get juveniles the help that they need so that they are not in and out of jail. And I think that's an important piece of this because there needs to be that piece, not just put people in jail. There needs to be the piece where we can help people understand what they're doing is wrong and making sure that we change behavior. okay? So those are three. I don't know if I've gone beyond my time. I enjoy this. I don't know. But the bottom line is that, there is another bill that's pending that some of the local representatives and I have talked about. It passed, the governor vetoed it, and until they take action on this bill next week, I don't want to get into that one because I just don't know, and I don't want there to be any confusion. Well, the chief went in front of CPARB and said this and this and this. Some of our legislators are leaning towards yes, some of them are leaning towards no. I hope the answer is no as a law enforcement official, but let's let that one go, and I'm happy to come back. So really, that's probably my time here for tonight. I will just touch base and let you know there's. Although we're very short-staffed, there's a lot of positive things happening within the police department. And Kelly, when you and I and Cam sit down to make the next agenda, I'd like to add some of those things so that people know that there's just a lot of positive things happening within the police department and the town. So.
That's good, yeah. And I just want to thank you for coming tonight. I know there's a lot of other things going on in town, and you guys are stretched really thin. I know we've got some significant staffing issues. I really, appreciate not only as a person on the board, but as a person, because this is an informal meeting, and as a person in Bennington, I appreciate, some of the things that I've been seeing around town. Personally, I live right down in the middle of the chaos with all of the trafficking and the drugs. So for me, S4 is great news. The prevention piece, I think, is huge. But I want to say thank you and to your whole team, because there's been a lot of stuff going on. Lauren and I have talked about some of the trauma, and we ask a lot of you and your department, and you really do. Everybody has bad days and everybody has bad moments, and there's always, through the whole scheme of life. But, and Marsh can back me up on this, you said it earlier, they care. When we did our ride-alongs, there's caring, and so thank you.
You're welcome. I think, I do agree with Marsh and Lorna's perception of my staff. They do care about what goes on in Bennington. They care about this community. Some of them don't live here because there's just not housing available. Some of them would like to move here. But going along with that, because you brought it up, we are moving forward. We might be down on staff. It's going to take us a couple of years, I think, to get back up to full staff. But there seems to be, and I would knock on wood if I had wood, there seems to be this renewed interest in law enforcement. I think it's going to come full circle, and we're starting to see quite a few applications, and we're interviewing people that really want to make a difference. And my goal right now is, be straight up with you, my goal right now is I would like to take the next 24 to 30 months to rebuild the Bennington Police Department and work with other law enforcement agencies in our area to help them rebuild, and just make sure that we can continue to work with United Counseling Service, work with the hospital, work with all of our other community partners. In supporting the Bennington Rescue Squad. They're struggling with staff, and Tom and I were just at their event, and they're struggling. We've transported people to the hospital in our police cars. As of late, we're changing some of the equipment in our cruisers, carrying more first aid supplies now, and we all have to work together to get through this little crisis that we've got going on. We all made it through COVID. It didn't used to be that if you had a paid fire department in Vermont that you had to advertise for help. You just kind of knew people that wanted to be firemen. Look around the state, departments that have paid fire departments, they're having to advertise and bring in people and interview. Police departments are struggling. The colonel stood up at the Vermont Law Enforcement Executive Summit and said they were down 52 troopers currently. And through attrition, it would not surprise me to see the state police go down another 25 to 40 troopers before the end of the year. And I think it's a struggle. The Chiefs Association is going to start meeting with the director of the Vermont Criminal Justice, the Vermont Police Academy. Going to start meeting with her bi-monthly so that we can understand what's going on at the academy. And this last academy class that just graduated, they lost quite a few candidates to injury or whatever the situation may be. We really need to stay on top of this. And there's just so much, and I don't want to take up any more time because it's not on the agenda, and I know this is an informal meeting, that's why I'm rambling a little bit, but I can tell you there's so much that needs to be done in this little state to make it better. So.
Tom's got a question.
You mentioned a couple times training with State's Attorney Marthage. Could you talk a little bit about how that training actually works?
Yeah, so usually every year, the State's Attorney's Office will take a look at new legislation, and we'll have a meeting with Bennington County law enforcement officers, and we'll go over the new legislation just to make sure that officers are on the same page. I'll give you a great example. I have specifically asked the State's Attorney Marthage to help us in Bennington County prepare an outline of an affidavit for someone that's suffering from mental health issues to help us basically have an outline of information that needs to be in there so that the judge will find probable cause to detain an individual and help them get the assistance that they need. That's just one example. Knowing what, another example would be knowing what her office is going to require of a law enforcement officer in Bennington County if we come across a firearm that has been defaced or doesn't have a serial number or what have you. And I think it's important. Every county is different, Tom. It's weird. Every county is different. We're fortunate that we have a good group of prosecutors that care about Bennington County, and they're going to put the training together. We'll have the training, and then officers will be allowed to ask questions. And the State's Attorney's Office here in Bennington County, they make themselves available after hours if my staff has questions, and we actually have a weekly check-in with one of the prosecutors. He comes to our office every Monday to make sure that he's on top of some of the cases that we're working. So it's important. It's just another piece of collaboration and knowing that the State's Attorney's Office is there for us if we have questions.
So work on the list of the things you want to talk about.
Sure.
And we'll talk about that for your section on or the BPD section on the July agenda.
Perfect.
So, thank you very much. Did you have any other questions?
No, thank you.
Jeff, any questions?
Yeah, I think you already answered it, but the soft restraint law, there was no accounting for budget in that, so you're just expecting to come up with the funds rather quickly. Is that accurate?
Yeah, and I don't want to focus on that too much, Jeff, because we'll make it happen. I mean, the town manager is great about making sure that we have the equipment that we need. I think that it's something that we knew it was coming, but there's not been a suggestion about like a specific model or a specific brand. And then, like I said earlier, it comes down to training and making sure that people know how to use the tools. And so, we're looking online. We're doing a little research. We'll get the equipment here, and we'll have that in place But yeah, that you are correct. Your assumption is correct. There was not, it's what we call an unfunded mandate in the world of the Chiefs Association. Hurry up, go buy this equipment. There's no funding for it. And like I said, the pricing varies from 200 and some odd dollars a set down to about $36 a set. And but the key piece in this is that every police car has to have them available.
Okay, yeah, I guess that's a good point. The equipment probably isn't the most expensive part of it, it's the training part of it that might be more involved. Okay, thank you.
You're welcome.
Marsh?
So that raises just another question, which is slightly tangential, but one to think about. When we first started CPARB, we thought about when are times when CPARB members might participate in training with officers to get a better sense for what's happening. And I'm not trying to advocate for this particular issue, but just to raise that possibility up for consideration.
Yeah, so one of the things that I would like to add to the agenda for next month, I'll just spill it, is I'd like to come in with the soft restraints after tonight's talk and just show you, what I'm talking about, soft versus mechanical, so that you all understand. I mean, mechanical restraints are not made to be comfortable. People will say, oh, you left marks. Well, when something metal is pushing up against your wrist bone because you're sitting on your hands, yeah, it's going to leave a mark. The mark goes away. It's not a permanent mark. But I just think, Kelly, that for next month we'll come in with those soft restraints, and I don't know, maybe Lieutenant Grandy would be happy to demonstrate them on Marsh. Not sure.
Great. I haven't been arrested.
I mean, it's a dream of mine. Just saying.
No, you don't want to put on the soft ones. You want to put on the real ones.
No, I'm just playing with you. But I think it's important that and especially for the people that are home, I think it's important that you get to see the difference between mechanical restraints and soft restraints so that people understand. I mean, I don't want to teach people to be a Houdini out of the soft restraints, but I just want to show you the difference in what our concerns are as police chiefs as far as officer safety. But then again, at the same time, the safety of the people that we're placing in soft restraints is important as well. So
It's a balance.
it's a balance. Yes. Okay.
Thank you.
Thank you.
Thank you.
Have a great night and thanks.
You too.
All right, so next up on our agenda is the community listening session. And that is going to be June 29th in this room from 6 to 8 p.m. We will have pizza and water and childcare for participants. The childcare is limited to 15 slots, so we do ask that you pre-register ahead of time. We have it in front of me. We do have a flyer, which unfortunately I can't find at the moment, but I will find. And that is posted on our website. It's also been sent out to some of the agencies, and we will have press releases out next week through Jonah with the banner and everything. So, Marsh, did you want to add anything to that while I get a copy of the flyer?
No, it looks very good, and I think it's going to be a great time to be together with the community. And I hope any of you who have positive or negative or creative ideas about policing come and share with us your thoughts, your hopes, your fears, your disappointments, because we need to hear from the community as a whole. And the hope of us is to engage everybody in making policing the work of our whole community, not just sending a handful of people out there and saying, you do it and we'll all whine if we don't like it the way I would have done it. So hopefully you'll buy in and participate with us and put your input in.
So it will be live on CAT TV, and we will have a behind this camera podium for people who aren't comfortable going on camera. We will also have the ability for anonymous written comments to be submitted during the listening session if someone isn't comfortable reading their own comment. And we will have our website, we have a comment form on that, and that will be monitored throughout the session in case somebody watching on CAT TV does have a question and wants to participate. If anyone has a question or a comment beforehand, they can reach out to me either by my email, kcarroll@benningtonvt.org, or through our comment section on our town website under going into the town of Bennington and then going under boards and looking for the Community Policing Advisory Review Board. And you can fill out something there for us. So like Marsh said, we are hoping that people will come and share your experiences, your solutions, or not solutions, but ideas and suggestions that you might have on what we can do, what community policing is to you and what CPARB can do to help be a little bit more, help increase the trust with BPD and transparency. So what we can do for the next year, that's what we're hoping for.
And the QR code, Kelly, on the flyer takes you to where to register for the childcare?
The QR code on the flyers does take you to register for the childcare that will be done for us by the YMCA, and it will be on site in the firehouse, in the lounge area. So we're hoping that people will come out. This is our first listening session. We hope to do several others around the community, whether we're talking about a collaborative community policing forum sometime in the fall. We'd like to get out to some of the community rooms throughout throughout Bennington, to meet with some of the people, whether it's maybe hopefully like Willowbrook or Applegate community rooms if they have that. And if you see us out and about, please, stop us. And June 29th, please join us here. As Marsh said before, we are not unfun. And we do have some pizza and some water, so come and tell us your thoughts in an informal session. We'll, we want everyone from Bennington to come. This is an open, inclusive invitation. Sam?
Sam Racino, Bennington, Vermont. First and foremost, I'm glad this date has come about. You folks have worked long and hard at setting policy and got training, and now you're acting out to the public. And I'm doing my best. I have a Facebook page to try to educate Bennington. I'm going to sound like a broken record. I don't mind sounding like a broken record because people don't seek information and be well informed about their town. And hopefully on this date, I hope many people come out and ask the questions because we don't have the time to ask questions when the officers are busy. Officers don't have time to answer the neighborhood questions because they say when a call comes in, they got to run. And
Sam,
if you do call dispatch, what?
I just want to remind you that this is a listening session. So this is more where we're hoping that people will come in and share their experiences and their ideas and, give us some input as opposed to a Q&A kind of thing. So I want to just set that expectation. If there are some specific questions,
you would have to go with them privately?
I want to make sure that you understand this is CPARB's listening session. So there might be a specific question that you may have about something that we may not be able to answer, and there may not be time for all the Q&A back and forth. It's not, I just want to set that expectation.
Okay, so it's not a question and answer?
It's not a Q&A, it's listening. So we want to hear, we want to hear about experiences.
So in other words, it's just like a select board meeting. You can sit there and comment, but later on, the questions will be answered, per se. You're gaining it.
There will be some. There might be, obviously if somebody asks a very specific, brief question and we can get an answer for it on the spot, we're going to do that, but it's really more about us trying to get information in
right,
without the back and forth. This time, Now, I might not say, maybe our next time might be a Q&A, and it might be something where we may get in there and we find out that maybe we need more of a Q&A. This is going to be facilitated by Brian Core. And then maybe, maybe the next time we will, or maybe there'll be a lot of similar questions on a specific topic or area or policy, and then we'll know that that's something we want to take a look at and build our plan. But I just want to make sure that you understand it's not going to be like a panel with the police department up here and all of these questions. It's CPARB's listening session, and we're going to try to get information about your experiences, like what you talked about with your dad. That experience and how, 10 years ago, it was different than it is now.
Right. So you're taking a temperature of Bennington, a survey.
This is our first listening session. We're a new board. We might think that this is the path that we are going, as long as we have to stay within our charge. Don't forget, with what we've been tasked with. But maybe something else might be, more important to the people in the community.
Right.
Or maybe there's another, sometimes current events dictate what we might have, for conversation here. So I just, it's our first one. I'm not going to say if you ask a question, we're going to just write the question down and say, well, we'll get back to you next month. That's not our intention. If we can get you an answer quickly, we will. But it's more of we want to hear from you and the community, your thoughts and input.
Okay. Glad you made that clear. And I will do my best to bring numbers to your event. Thank you.
Sam, I appreciate that very, very much. And I appreciate you coming in tonight. Thank you. I should say we appreciate. Any other comments or anything? Did I forget anything from the listening session that you can think of, Marsh or Jeff?
Jeff?
Yeah, I'm good. Sorry, I was trying.
He's still awake.
I'm slow.
All right, so that's pretty much it for the community listening session, unless anybody can think of. Okay. We're not going to talk about the 2023 town survey. We'll talk about that next month. Upcoming agenda items, we'll be moving this month's agenda into next month. BPD does come every month and talk at least for a few minutes. So next month we will be hopefully having a demonstration with the soft restraints. And then the only other announcements that I have, and I may even turn this over to you, but I just want to remind everybody on Saturday, we have the Juneteenth, SVSU has the Juneteenth celebration, and that is down by the school district's offices on the field out on Depot Street. So I would encourage people to attend that. They put a lot of work into it. I believe it goes from 12 to 3. And there's a lot of great information to learn. So if that is something that people are looking for something to do on Saturday, I encourage you to attend that.
And it's of interest also to children and young people. There'll be books given away and fun projects to do, and should be a great time, and about, I think, 20 or 23 different groups that are going to be there. So we'll get to meet the coach for the Bennington Martins basketball team, and you'll get to meet a lot of other great people. Should be a wonderful time. Hope I'll see you.
If nobody else has anything else, thank you very much for putting up with us with our informal meeting this evening. Thank you to our guests, to people who came in and spoke for community. We appreciate it, and our next meeting is Thursday, July 20th at 6 p.m. I hope that's the right date.